Now, this was not the plan when the original announcement of the new hospital was made. With losing the birthing center, what will fill that space?
Our plans to fill that space is we are going to expand our medical surgical capability. We're going to actually be able to add 8 additional medical surgical beds with the supporting technology and equipment that's needed on that unit, on that floor. From a regulatory standpoint, they require us on an OB unit to have a specialized C-section room, which is a very expensive OR that's used in this case very seldom. And of course, the larger rooms required for labor and delivery. We're going to be actually replacing the 4 LDRPs and actually being able to double the number of medical surgical beds that we're going to have in our community hospital. So we give up 4 for 8 additional medical surgical beds, which based on the market share, the demographics, that's where our community is going to need us in the future.
Lindy, surely you understand how people talk and get upset. We're building a new hospital, talking about declining Medicaid payments. People are concerned about losing other services. Several folks have asked about our emergency room services. Aren't the number of Medicaid patients just as high? Could our ER service or what other services could be in jeopardy?
It's a good question, and I understand why our residents and our concerned community members would be asking, are there other services that are at risk similar to OB? And the answer to that is no. OB is a very specialized service, less than 230 deliveries a year. There is not another service that compares from a payer mix standpoint, being 66% Medicaid on our obstetric service line. There's not a service that comes close to comparing to that payer mix. When we talk about our emergency room, we're really fortunate. If you talk about the number of encounters, we encounter anywhere from 1,500 to 1,600 patient visits a month. That's a month. A very busy service for us and a core service that the community absolutely has to have. So that service would never be at risk here. And in fact, the plans of the new hospital and our emergency department doubles the square footage of our emergency department in regards to square feet. From a payer mix standpoint in the ED, the payer mix from a Medicaid percentage is about 28% of our Medicaid, of our 1,500 visits are Medicaid. So we have a much healthier payer mix in the emergency department. But regardless of the service, regardless of the payer mix, an emergency department in a community hospital is a core service that we will always continue to support. And we do that well in our community hospital. We're staffed with not only a physician, which comparatively to other hospitals in our region, we also have, on top of having the MD in the emergency department 12 hours a day, we are committed to having a physician extender, which helps us best meet those needs from a community's perspective. And we are staffed, much better than a lot of hospitals in our region for our size emergency department, and we are very committed to that. Other services, you want to talk about other specialized services. There's not one that compares to the specialized service like OB with the declining volumes and with the minimum patient encounters a year. Now, that doesn't put to rest those mothers that were expecting to have their babies here. I had my babies here. This has been an emotional decision, and I understand why the emotion plays into it. But fundamentally, it's our responsibility, this board of directors, responsibility as well as leadership, that we offer services that are needed, and we offer those at the highest quality level. And they're services that we can maintain good physician coverage, good competencies, good physician coverage. That's what we're committed to doing. So I want to put to rest that there's any other services at risk here.
Talking about the emergency room, I was eating chili beans at Rolling Hills Market the other afternoon, and someone said to be sure and ask Lindy if an emergency situation arose, would the hospital be able to deliver a baby here in Smith County? Will you still be able to provide that emergency service?
Absolutely. And we will absolutely make sure that mom and baby get the appropriate care. we have all of our physicians in our emergency department are family medicine trained. And as probably a lot of us remember, many of us were delivered by family practice physicians years ago. Some of that has gone away because it has moved to a more specialized service, including the physician piece. But our ER physicians and our staff, including us working closely with the local EMSs, will be prepared in emergency situation to deliver a baby. Absolutely. We'll have the equipment there available. We're going to have the staff education that we're going to re-educate our staff, make sure the physicians have what they need, the equipment to ensure a safe delivery in those emergency situations.
What about our pediatricians? We have two building a beautiful facility in Marion. Now, how do they feel about this decision, and do they feel an impact coming?
One of the, after the physician conversation with Dr. Humsey and Dr. Clary, which of course is the series of discussions we had with their doctors, the pediatricians were, close behind those discussions with the obstetricians. I have had personal conversations with both groups since this decision. And, while I think we're all saddened that, we are at the position where we're looking at this consolidation, our pediatricians understand, the rationale behind the decision. The quality guidelines say if you can consolidate and you're less than 500 babies, you need to consider consolidation. Our physicians are up on those quality indicators, and while they, are saddened by the announcement, they also feel that this will not impact their ability to thrive, to do well, to offer services here in the community, to work with Drs. Humsey and Clary and other physicians to ensure that that care and that transition of the baby back to the pediatrician is seamless. They will continue to be focused on that. So we've worked closely with them. 20% of our deliveries from Smith County residents have historically gone to JMH. And that was one of the responses, some of the discussion we had with the pediatricians is they've had success in gaining those patients back, earning the commitment of our local residents to support a local pediatric office as well as the other group. So we are blessed here to have a strong group of pediatricians, two very strong groups committed to providing pediatric services in this community. And I'm confident that they will continue to thrive and grow, and that this decision will not adversely impact them.
What about the current facility? Many are concerned that the current hospital will turn into an eyesore, degrading the community it sits within, and now we've heard rumors but no plans. What do you have in store for this campus?
We've done a lot of work on that. We've spent, now just over 2 years since we announced the final plan to replace the hospital. And we've gained some real good traction. We have a group we refer to as the Reuse Committee that meets regularly. And we met last year and kind of slated the top priorities of what the community leaders, management, local leadership here would like to see this facility turned into. And number one, we want to ensure that we're going to do the best of our ability to make sure it's a positive economic engine left behind in this facility. And so one of the really exciting projects that we're working on now and just got board approval for is a partnership with Emory and Henry College